We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Niswi, Ishkwiden, Anishinaabeg, the Three Fires Confederacy, Ojibwe, Odawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. Good evening, everybody. Welcome to the February 3rd Windsor Regional Hospital open board meeting. I'm going to call the meeting to order. Do we have any declarations of conflict of interest? Seeing none, wonderful. Can I get an approval for the previous minutes? That's Paul Lachance, seconded by Cynthia Bissonette. Thank you. Questions or comments with regards to those minutes? Seeing none, all in favor? Perfect, thank you. And as usual, I'll start off by acknowledging a couple of our fundraisers that are going on. So as you can see, I've got the hats on for healthcare. The Windsor Regional Hospital Foundation's annual event will launch on March 2nd and run through March 30th this year. This year, it is a virtual event. Individual organizations and businesses are asked to participate by wearing a hat and making a donation of a toonie or more. Watch for details on our website at www.hatsonforhealthcare.ca and our social media. This year's event supports WRH's mental health programs. It's an easy and fun way and we suggest everyone participates. Watch for informative and entertaining online launch and activities through the month. So again, that's going to launch on March the 2nd. The other one of our partners that I'd like to acknowledge today is BANA. It's I believe it's their Bulimia Anorexia Association's month, and I believe Caesars has actually turned the building purple on behalf of that organization. So congrats to BANA. I know they do fabulous work, and I know Jonathan Foster does some work with them through the hospital. So thanks everybody for your hard work. And we will keep moving on here. So I can take this off, thankfully. So we will go directly to the report of the President and CEO, David Mouchier. David.
Mr. Chair, and welcome everybody tonight to snowy Windsor, Essex. It's the last time I make fun of people from outside of Windsor, Essex when they had all the snow a few weeks ago and we had none. We are paying for it now. So welcome everybody. I'm going to highlight some things going on provincially. And then also we'll be handing it off to Dr. Saad partially the way through my slide deck. So what this is what's going on with respect to the province, Provincial Snapshot. And where this is taken from is a range of scenarios that were put together by the Ontario Science Advisory Table. And as you can tell, what I want to highlight here is the range of scenarios that you see over to the right side when you have low community immunity, moderate, high, and what the impact is going to be and where things are going to settle at over the next month or so with respect to COVID. So unfortunately, because of various factors, it's very hard to determine how things are going to be moving forward with respect to Omicron and decisions that have to be made. Now, just looking at the impact this has with respect to current adult inpatient COVID med-surg census and projections, you'll see the impact the previous slide has on projections moving forward. The science advisory table, the various scenarios are on the far right side, the SAT, and it talks about what high community immunity, moderate or low, and the impact that might have with respect to where things are going to fall out regarding non-COVID patients, and then at the bottom regarding COVID patients, and how this is going to impact the census here in Ontario. And when we had a recent presentation before the finance minister, one of the things we did highlight is the fact that you don't have to look far to look at, unfortunately, what Ontario is struggling with and why it struggles when there is a larger increase of COVID patients on demand. Is, for instance, the state of Michigan has 40% less population, yet it has 40% more critical care beds than Ontario does. And that's something that has been around for quite some time. That's not something new with respect to this government. All of the lack of critical care beds has predated the last 3 years, 4 years, and is a decade old or longer old problem for the province of Ontario. So that's where we do not have hardly any flexibility in the system to handle a surge of patients, be it even during influenza season, let alone what we're seeing with COVID and normally what happens during this time of the year as well. One of the things that was recently discussed is regarding Directive number 2. And what Directive number 2 is, it's the pause that was put into place for non-urgent and it's supposed to be emergent, sorry, non-emergent procedures, and a pause that was put into place for those two types of procedures. And again, it's based upon flex in the system, ability to withstand a surge of patients. And unfortunately, we cannot. Directive 2 was in place for a few weeks now. That has created physical capacity in hospitals across Ontario to handle the surge in patients. And it is still in place. It was recently revised. It was not rescinded. And the first revision is phase 1, which takes place now. And what that basically says is that we're able to recommence diagnostic imaging, so elective or scheduled or outpatient diagnostic imaging procedures, cancer screening. Pediatric hospitals may resume all activity. Scheduled ambulatory clinics are clinics. It's not day surgery. So surgery is not increased until phase 2, but they outline certain indicators that must be met before the province moves into phase 2. You need declining hospitalization, stabilized, declining med-surg bed occupancy, number of outbreaks reduced, stabilized HHR across acute care, health human resources. There's 4 phases. They're estimating to move from one phase to the other will take from 1 week to 3 weeks, possibly longer if things don't continue to progress. And all those factors will be taken into consideration before there's a move to phase 2. The concept is, with respect to phase 2, if we move to phase 2, it's 70% of our 2019 volumes when it comes to surgery. Right now, we're running at about 40 to 50% of those volumes. And then when you get to phase 3, you're up to 90%. Phase 4 is 100% or greater. As stated at previous board meetings, is the team's done a considerable amount of work entering Directive number 2. We had just over 3,000 surgeries that were on the wait list. That number has, of course, increased to closer to just under 4,000 right now. But we have to remember, entering COVID, the number was over 6,000. So a lot of work has been done even during COVID to get that number down when we were able to do so. So we still, of course, when we come out of this, have a lot of work to do in front of us with respect to that. And we're not alone with respect to that issue as we move forward. One of the things I want to highlight is our approach. And this is a great memory tool, a great tool to remember that everything we do is to reduce the risk of acquiring and or spreading COVID. And all of these factors we have put into place either at Windsor Regional Hospital or been a part of. One cannot pick one of these pieces of Swiss cheese and pull it out and say, you know, I don't want to wear a mask, so let's throw that out, and expect to keep the same reduction of risk that all of these factors together result in not having the spread take place or acquiring COVID in the first place. You need all of them. They all play an important role in the acquisition and or spreading of COVID. So you can't pick one out and say, you know what, I'm not going to get vaccinated, but I'll wear a mask and that should be fine. No, you have to take advantage of vaccines, and that's proven with respect to the impact of patients across hospitals with respect to how vaccines work still, with respect to reducing the spread of COVID, the time someone is infectious, and also the outcome a patient might have. And that's shown right here with respect to the science advisory table. This was in their slide deck they just completed. And the conclusion is unvaccinated people currently have a 6-fold higher risk of being in the hospital and a 12-fold higher risk of being in the ICU compared to people who received 2 or 3 doses of the COVID-19 vaccine. Some people out there in the community might say, oh, well, I look at your numbers and you have, you know, vaccinated individuals with COVID hospitalized or vaccinated individuals in the ICU with COVID. Well, when our population is 80% plus double, let alone 40 to 50% triple dosed, it's pulling from a much larger group of individuals as compared to the 10 or 15% that are unvaccinated. So unless those same proportions continue on, that is where you get the 6-fold and 12-fold numbers from, is the individuals who are unvaccinated is pulling from a much smaller pool of individuals out there. And that's why these numbers look the way they do with respect to the impact of being unvaccinated and whether you're hospitalized and are put into critical care or unfortunately pass away with COVID. So I'm going to pass it over to Dr. Saad, who's going to talk about vaccine and its safety.
Thank you, David. So one of the things that we always look at whenever it comes to any medical therapy or treatment, and specifically with vaccinations, is the question of safety. We know based on what David just presented that they're effective at preventing severe illness, they're effective at keeping people out of the ICU. But the question is, are there a lot of side effects and reactions? And now we have a good year of data to look at. We have a year's worth of data from Windsor Essex population, and we also have Canadian data to look at. In Windsor Essex, as of the end of December, so a full year from December 2020 to the end of December 2021, there have been almost 800,000 doses of the COVID vaccine administered. And then when we look at our data, both Erie Shores and Windsor Regional Hospital, we've had 89 ER visits over the course of the year to our hospital, 67 to Erie Shores, related to COVID vaccines. Of all of those visits, only 2 patients were admitted to Windsor Regional Hospital, one at each site, and one with pericarditis and one with myocarditis. And it's interesting to note that despite these 2 patients who did quite well, by the way, and were subsequently discharged from hospital, they completed their vaccine series and end up getting their 2nd and 3rd doses of the vaccine to protect against severe illness. So when you look at our local data and you work out the odds, there was about a 1 in 5,000 chance that a Windsor Essex resident attends the emergency room following a COVID vaccine. So an extremely low rate. And the chance of you ending up in hospital and admitted after receiving a vaccine is closer to 1 in 400,000. So extremely low rates of local reactions to the vaccine. When you look at all of Canada, there have been 75 million doses of the vaccine administered in Canada. And based on the adverse event reporting system called CAFIS, the total adverse events that have been reported out of 75 million was 35,000. And those 35,000 were further subdivided into non-serious adverse events, things like prolonged rash, something that didn't really need to be reported, versus serious adverse events. And there were only 7,500 adverse events out of 75 million, which is a 1 in 10,000 chance. And when we look at the adverse events a little bit further in more detail, autoimmune disease accounted for about 179. And I should say that this also takes into account not just the mRNA vaccines, but all the vaccines. So this also includes the data from AstraZeneca. And we know that the autoimmune disease category is mostly what we call ITP, or autoimmune thrombocytopenic diseases, where the platelet counts dropped. Cardiovascular disease, specifically myocarditis and pericarditis, was the highest at about 1,800. And if you look at the rate per 100,000, it's about 2.2 per 100,000. So really, you would have expected closer to 6 or 7 people to have myocarditis, pericarditis in Windsor, Essex. We've had 2 admitted to hospital. Now, some may have developed it. It could have been mild and didn't require hospital admission, because we know that these are mostly self-limiting. Circulatory in that category would be diseases like DVTs and PEs, and you can see the rates there, and then all the others. So again, very rare to have any of those complications, and none of those really led to life-threatening incidences, but there have been some reports of death. So up to including January 21st, there have been a total of 227, and that's out of 75 million, with an outcome of death. There are reporting standards to investigate whether a death was directly related to a vaccine or not. And of those, 135 could not be assessed because of insufficient information. 97 of those deaths were deemed to be unlikely related to the vaccine, which then left about 45 reports of death that are still under investigation that could have been related to the COVID vaccine. And that, again, is out of 75 million, which translates into about a 1 in 1.6 million chance of dying. And again, that's assuming if all those 45 deaths are investigated and subsequently deemed to be directly related to the COVID vaccine. So that's on the high end of the estimate. And just to put that into perspective, not that I think anybody, on this board thinks that that's a high likelihood, but your chance of dying from a lightning strike this year is about 1 in 138,000. The chance of dying from a sunstroke is about 1 in 82,000. Chance of dying in a car crash is about 1 in 107. So you can see that these rates of death are much, much lower than any possibility of dying from the vaccine. Now, even though winning a gold medal has nothing to do with death, David insisted on putting this in there. So David's chance of winning a gold medal is anywhere from 0 to 1 in 661,000 at the higher end of the probability scale. And again, still less likely than him dying from a vaccine. The other thing that I wanted to update the board on was the antiviral and the antibodies, monoclonal antibodies. So for some time now, last couple of weeks, Windsor Regional Hospital was selected as one of regional sites in the province to administer a monoclonal antibody called sotrovimab, which should be given to people within the first 5 days of an infection. And most recently, a new antiviral called Paxlovid has become available as well. And these treatments, unfortunately, for now anyways, are being restricted, mostly because of supply, to the highest risk people that would benefit the most from it. And going back to an earlier slide that David presented, and the Ontario Science Table has clearly recognized that those that are at most risk for dying or ending up in the ICU are the categories that you see there. And you'll notice 2, 3, and 4 all start with unvaccinated. We know that unvaccinated people are at the highest risk of dying from COVID or ending up in the ICU. And if you are vaccinated, being immunocompromised also puts you at a significantly high risk as well. And that's part of the reason why, with a limited supply of these antivirals, we have to limit them to the highest risk people, because again, we're trying to protect people from dying from severe illness and keeping them out of the ICU. To date, we've had 16 doses of the monoclonal antibody sotrovimab administered at Windsor Regional Hospital. and none of the Paxlovid being administered yet. And our experience with Paxlovid is not very different than higher referral centers. We recently had a call with Hamilton and the GTA, and Paxlovid numbers are in the single digits at this point in time. And part of that reason is because there are so many drug-to-drug interactions with Paxlovid. It's not as simple as an antibiotic. Unfortunately, if people are on medications specifically for transplant, but high blood pressure medications, blood thinners, there are a lot of interactions, which is why our team is very well equipped to make those decisions. We have excellent pharmacists on our team as well that will look through the interactions and ensure that somebody's a candidate. But for now, we're trying to do our best to give patients that qualify for these treatments the best treatment possible to hopefully mitigate their risk of progressing to severe disease. And I think that's the end of the slideshow.
Yep. Thank you, Dr. Saad, for providing that. And yes, I'm the one who asked to give the example of winning a gold medal in this year's Olympics, just to give it some context since they're underway. And just to identify that the risks, even assuming the 45 are all attributable to the vaccine, which they will not be, if arguably any of them, the odds are very low, let alone a negative outcome and or clearly death as a result of being vaccinated. And as Dr. Saad pointed out, we're closing in on 1 million vaccine doses in Windsor, Essex, and with very limited impact of people having coming to the ED with soreness to their arms or issues like that. Those are the group of people coming to the emergency department. So that's my report, Mr. Chair.
Thanks, David. Questions or comments for David or Dr. Saad? Dr. Saad, I just want to say congratulations on all the fantastic work you do on AM 800 on Tuesdays. You are a patient man, and you are a fountain of information. This week was stump the doctor, but you handled it extremely well. So thanks for representing well.
Thank you, Anthony. And I never thought I would ever have to say on radio out loud that the COVID vaccine does not cause baby devil eyes and cause baby's eyes to turn black, but I had to say it out loud this week.
Oh, we appreciate what you're doing. So next up, we're going to have the CNE report with Karen Riddell. Karen.
Thank you, Mr. Chair, and good evening, everybody. And Matt, if you could just bring up my presentation for me, thank you. And next slide. So last month, it seems like this month actually flew by very quickly, but we discussed strategies that we were using at Windsor Regional Hospital to sustain our health and human resources moving forward. And we've had many examples of how our amazing team members, our frontline and our professional staff have truly gone above and beyond for our community during these challenging times. But tonight I want to focus on just one of those team members and one of the most successful strategies that we've implemented to date, which is called our Uni Program. And this is the background here on this slide is actually an article that St. Clair College had published highlighting this work. So I've got a link there for anybody that's interested to read that. Next slide, please. So early in the pandemic, again, which seems years and years ago, but it was back in February of 2020, we were looking at all options to really bolster our HHR capacity. We were very concerned at the time that we were going to draw from our community and long-term care partners. We did not want to take resources away from there, which were desperately needed. And we were looking at all possible alternatives. So one of our team members actually at the hospital, Nicole Kerwianek, who's actually our director for critical care and cardiology, had worked in another facility that had experience using a program that utilized nursing students. So we took that idea, we adapted it to our needs locally and for the pandemic, and that's where this program was really born. So UNE stands for Undergraduate Nurse Employee. And we also expanded this to include undergraduate respiratory therapy employees who are RT students that would assist our respiratory therapist with the increased demand that we were seeing for advanced respiratory support. And the idea itself was strengthened. This idea itself actually strengthened an already solid partnership between Windsor Regional Hospital and our local nursing schools at the University of Windsor and St. Clair College. Next slide, please. So by the end of February 2020, we had developed our UNE job descriptions. We worked with our partner nursing schools and started recruiting. People might not recall, but early in the pandemic, many of the schools had actually stopped in-person learning, and many of these students were available to start immediately. So our first UNEs were actually onboarded in March of 2020, and we really haven't looked back since. Our UNEs, currently over 200 of them, are employed in every clinical area in the hospital and also in our COVID-specific services, including our COVID assessment centers, which Dr. Sad just talked about, and our vaccination centers. Next slide, please. So what we're going to share with you now is actually a video that's just a very small sampling of our UNEs and their feedback on what their experience has been working for us throughout the pandemic and how this has contributed not only to the community, but also their growth and their future career.
Hi, my name's Kristen. I'm a third-year nursing student at the University of Windsor. I'm currently a UNE at the Windsor Regional Hospital Vaccination Center. I've been working here since March of 2021. I'm very grateful for this opportunity Windsor Regional Hospital has given me. It's allowed me some extra practice and also in addition to my clinical placement.
Okay, my name is Sebastian Oyozo. I'm a fourth-year nursing student working as a UNE. I was positioned here at the vaccine clinic. I like my position here. I can get more experience with people, be able to be more confident going in and talking to people and interacting with clients and giving them the best care I can possibly give.
My name is Rob Moore. I'm also a fourth-year nursing student from the University of Windsor. I'm also hired here as an undergraduate nursing employee, or UNE. I found that this job has really helped with my confidence and just interacting with patients, getting to know different populations, different diversity groups, just getting comfortable. I found that's really helped advance.
Hi, my name is Sophia. I'm a third-year nursing student. I was hired on as a UNE for Windsor Regional Hospital back in December of 2020, and I've been working for Windsor Regional since. I've been positioned at the vaccination center, and I've been extremely grateful for the opportunities that I've been given. I've been able to advance my knowledge in my nursing career, and my nursing profession. I've been able to expand my clinical expertise as well as patient education, and I'm excited to see what this transitions to from a nursing student to registered nurse.
Hi, my name's Nicole, and I'm a third-year nursing student at the University of Windsor. I'm currently a UNE at Windsor Regional, and I've been placed at the Vaccination Center. I've been really thankful for this position as it's given me the opportunity to give back to the community, especially during school and during this time. I'm also thankful to be helping out all the nurses here, and I'm excited to see where this goes.
Hi, my name is Kiana Padilla. I'm a fourth-year nursing student at the University of Windsor. I began my UNE position in May of 2021, and I currently work in the ICU at Metropolitan Hospital. I can honestly say that being a UNE has given me experiences that I never thought I could have as a nursing student. Even just like being in the atmosphere, I feel like I've just learned so much and seen so much. The nurses are always so willing to teach the nursing students, and they're always pulling us in to show us things that we haven't seen before, which I find amazing. I really feel like the UNE position has consolidated my training, and it's honestly made me so much more comfortable with nursing in general, and especially that I'm graduating this semester. I'm so happy that I was able to do something where I was gaining experience and also helping out during the pandemic. I really recommend the UNE position to any student, no matter what year you're in. I feel like it's a great way just to get your foot in the door and just to be in the environment of working in a hospital, whether that's what you want to do or not. You're still interacting with patients, still caring for patients, and I honestly love my job and would change it for the world.
Hi, my name is Lauren Hodgins, and I'm a third-year nursing student at the University of Windsor, and I'm also a UNE at Met ICU. I've been there since December 2020, and it's been such a good experience. I've learned so much. I've made so many connections in the hospital, and I've been able to help out along the way, which is also really rewarding, and it's something that I'm grateful that I'm able to do, especially in a pandemic. There's a lot of staff burnout, and I feel like these students, all the unis on any floor, have been of such great help, and I hope that this program can continue.
Hello, my name is Madison Mitchell. I am currently a third-year nursing student at the University of Windsor. I have been a UNE since March of 2021. I got hired on to work in the Indigenous Center at the vaccination clinic. I am currently a member of the Métis Nation of Ontario. I have had the opportunity to vaccinate many of the Indigenous individuals throughout Windsor-Essex County, which I have been very grateful for, and it has been a very eye-opening experience for myself. I have also created new relationships throughout our entire community, and I have gained so much knowledge throughout my career as a UNE that I am very grateful for, that I will take on into my future as a future RN.
So I hope you enjoyed those videos. Again, that's just such a small sample of such a valuable team member that they have become. So one of the great things that did happen last year, early in 2021, the provincial government actually initiated funding for an extern program to support implementation of this model at other hospitals provincially. So we're very hopeful that this will continue on into the future, because it has had so many benefits. It's helped us maintain our patient care services. It's supported our staff. It's contributed to the growth of our future nursing workforce, which we talked about last month, and how much of a need there is to really bolster our frontline providers. So we really could not have gotten through this pandemic without our UNEs and our longstanding partnership with the University of Windsor and St. Clair College. And truly, our Windsor Regional Hospital team would not be complete without them. Thank you, Mr. Chair. That is my report.
Thanks, Karen. Appreciate it. Questions or comments? All right. Well, it's a fabulous program, so keep up the good work. I see between Patty France and Dr. Freeman, I assume that they can only say great things about this program and the experiences that both of their students have received within that Uni program. So congrats. Next up, we have Dr. Jacobs with the Schulich report.
Thank you very much, Mr. Chair. Apologies for being off camera. I'm just driving right now and I couldn't get parked in time. The report is attached, and it is very brief this month. I just want to draw attention to a couple of issues. One is an exciting collaboration that we run with the University of Windsor. The Schulich U Windsor Research Excellence Program is again accepting applications for 10 grants to support local research projects between medical students and University of Windsor researchers. And so this is, I think, now the 8th iteration of that program. It's been in very high demand, and we're excited to continue that collaboration with the University of Windsor. Second item I wanted to bring up is our awards of excellence. Schulich faculty members, staff, and students are all up for awards. If you see or deem them, if you want to recognize them, excuse me. So those awards are up, and our deadline for those applications is the end of this month. So excited to once again honor those individuals. And the last thing, just reminding all of you that our fourth-year medical students are now in the process of interviewing for their residency applications. In Windsor, we have 10 family medicine positions available, 6 to Canadian medical graduates, 3 to international medical graduates, and 1 in the military officer training program. We also have 2 of our psychiatry residency positions open as well, 1 for a Canadian medical graduate and 1 for an international medical graduate. That's my report. Happy to take questions if there are any.
Thanks, Dr. Jacobs. Questions or comments for Dr. Jacobs? You're getting off scot-free, Dr. Jacobs. Next up, we have the financial presentation by Penny Allen. Penny, take it away.
Okay, thank you. The first part of what I'm going to say is the financial results for hospital operations. A 6.4 million deficit for the hospital operations year to date, which would be December 31st. And the net deficit after the building amortization is higher, of course, $7,657,000. The COVID-19 unfunded and ineligible expenses total $3,936,000 based on the current reimbursement rules. COVID has resulted in non-ministry revenues being under budget by 3.7 million. That's things like the parking, the cafeteria, that kind of thing. They don't fund that revenue. That's lost. Unearned ministry volume funding being under budget by 5.1 million. A year ago, that number was 8.6 million, which making this a significant improvement between going down from 8.6 to 5.1. The recent communications indicate that the ministry will require year-end reconciliations and a recovery of unearned volume revenues that non-ministry revenue shortfalls will not be funded. However, we expect the advocacy by the Ontario Hospital Association and the hospitals of themselves will see a similar plan as last fiscal year to make hospitals whole and not be negative impacted by that pandemic. So fingers crossed. The next thing is COVID impact on expenses. The breakdown of where the 3.9 million to date in extraordinary expenses and in 3.7 million in lost revenues are impacting our financial statements. So the pandemic certainly has an impact on the financial statements. The revenue, the base and one-time funding is 25 million favorable due to amounts that have been accrued for knowing COVID-19 reimbursements. These include the quarterly 1 and quarterly 2 incremental expenses, temporary physician payments, vaccination and assessment center funding, nursing extern funding, and screening costs. That's quite a few. Ministry drug reimbursements for high-cost drugs is favorable, $1,397,000, but these are offset by higher drug expenses. Patient services revenue is $2,449,000 favorable, relates to uninsured patient revenue from the ministry, and a higher diagnostic revenues, which are offset by higher medical staff remuneration expense. Other recoveries favorable, $1,567,000 is the retail pharmacy revenues, but they are also offset by higher drug expenses. And now for expenses, 32 million to date unfavorable variance in expenses. The majority of these expenses are COVID-19 related and are confirmed or eligible for funding, so that's good. Medical surgical supplies are 3,275,000 unfavorable due to increased use of PPE, depletion of donated PPE supplies, that's the masks, and volume increases as procedure backlogs are addressed. So they're not getting back money for the PPE. Oh, okay. All right. The drugs, 1.7 unfavorable. Their systemic and renal drugs are funded by the Ontario Health, and additional drug expenses in retail pharmacy are offset by recoveries noted previously, like this. Other supplies variance of 10.5 million and includes, this is the 10.5 million, 3,561,000 in additional Evolve HIS project costs due to COVID-19 delays, which have been funded by the ministry. And now the Evolve is the new computer work that they've been working and 3,456,000 for referred out vaccination center expenses, like for the City of Windsor and the County of Essex EMS are also fully funded, which is good. And 1,940,000 for referred out cataract procedures, which are fully funded. I believe that is referred out to another eye clinic that is near Metropolitan. So yeah, that is my report. Could I make the move, Anthony?
All right. Perfect. Thanks, Penny. And then can get that seconded by Ian McLeod. Thanks, Ian.
Okay.
Questions or comments with regards to that report? Kudos to the team for keeping finances up and center, or front and center, pardon me. Honestly, challenging days, so good work.
That's the staff that are doing the good work there.
Perfect. And then, so no questions or comments. Can I get a motion to approve? Or sorry, all in favor? Geez, I can't remember what I'm doing anymore. Perfect. Thank you. Nobody was opposed. Appreciate that.
Okay. And then the next one is the minutes, basically, of the January 24th meeting of FAR. So I move that the report from January 24th, 2022 for Finance, Audit, and Resources Committee meeting be accepted. And that's the minutes.
Seconded by Paul Lachance. Questions or comments? Seeing none, all in favor? Thank you so much. All right, and then we have the correspondence and printed material there for your review. Any additional questions or comments? All right, wonderful. So I'm just going to read what I was supposed to read. I had some technical difficulties. So it's Eating Disorder Awareness Week this week. That's what Bulimia Anorexia Nervosa Association is promoting this week. So I do apologize for getting that wrong. My screen froze. So this whole week, they'll be drawing attention to the causes, prevalence, and impact of eating disorders and spreading awareness. They hope to inspire others to take action and advocate in support of those affected by eating disorders. They also aim to highlight the voices of our community and those with lived experiences in the fight against eating disorders. So go visit their website at www.bana.ca/EDAW. So that's Eating Disorder Awareness Week. So they do some fabulous work. And that is all for tonight. Our next scheduled meeting is obviously the first Thursday of March, which is March the 3rd. Can I get a motion to adjourn? Patty France, seconded by Dr. Freeman. I assume there's no questions or comments. All in favor? Perfect. Thank you. So if everybody can be back in, why don't we say 10 minutes? Does that probably gives everybody enough time for the perfect. All right. Well, everybody stay safe. Remember to bend at the knees if you're shoveling outside. Warm up before you get out there. David and the staff do not want to see you in the hospital. So please go easy while you're shoveling snow. All right. See everybody March 3rd.